Hey, we got the one and only Dr. MJ Collier on with us this morning with everything going down with COVID-19, man. And Joe Biden said it's about to be a dark, cold winter. Dr. Collier, good morning.
I agree. Good morning, Rickey Smiley. I agree with our president-elect. It's going to be a dark winter because even with the vaccines that are available, it still won't be available for the general public for at least 3 months, which means we got to get through this winter. The FDA is scheduled to weigh out on the Moderna vaccine tomorrow, and this will bring that biotech one step closer to the finish line. It's recommended for adults 18 and older, whereas the Pfizer goes down to 16. They use a similar technology to mRNA technology, but it doesn't require the ultra-low refrigeration that the Pfizer vaccine requires. It shows 95% efficacy and was especially effective in preventing severe symptoms. Now, Moderna's trial was also more robust. They had more minorities and more older individuals, they say elderly, in that trial. So the people that are most affected, minorities and people of color. So that shows that, this might be one we definitely want to consider. Rickey, yesterday they had a study that showed 1/3 of blacks still remain hesitant. That's the word they're using. Hesitant to get the COVID-19 vaccine. The reasons for hesitancy in the black community among those not likely to get vaccinated, that's 1/3 of those. One, worried about side effects. Vaccine is too new. Don't trust vaccines in general. Don't trust the government. So, those are actually what I would consider reasonable concerns. So, we got to get the information out there to let people know. The main thing is that it is not disease-causing. None of these vaccines can give you COVID virus, and they can't make you sick because of the technology that's available. It is new, however. And, and I actually think that because there's going to be a slow rollout to the general population, we'll get a chance to observe any potential side effects. They also authorized a new rapid at-home antigen test. This is not a PCR test, but it's an antigen test. And they say that it actually has reasonably high accuracy. It'll only be $30. You can buy it at the drugstore, swab your nose, run a test, and get your results in 20 minutes. No doctor involved, no healthcare provider. So you can get that information independently. And I think that's going to be very popular because I'm getting those requests on a daily basis now. People want rapid testing. People that are going on site on movie sites, they need the information. People that are traveling, some of the airlines or the destinations require instant information. Now, that doesn't mean that they're going to accept this as a valid test for those situations, but it will be out there and we'll see how it's accepted in the community. So, the coronavirus infections are expected to peak in the latter portion of January. So that's why I think we're going to have a long, dark winter.
Yeah.
So
go ahead.
I was going to say a few questions that people are asking. Do I need to get vaccinated if I've already had coronavirus, the COVID-19? The CDC is not providing any guidance on that, but Dr. Collier is saying that you get natural immunity. If you test positive for antibodies, then you need to consider getting a vaccination at that point. Can you say that again, Dr. Collier? I'm saying that if you have tested positive, if you've had corona and test positive for antibodies, then you're going to have you have antibodies. What the vaccine does is give you antibodies. You already have them. So then you have an opportunity to do some consideration about getting the vaccine and don't have to be in a rush to get it, so to speak. And you can get a chance to see, whether it's going to have any substantive side effects and worry about safety. But you already will have protection, and that's what the objective is. And so I'm telling people, if you've had it, get your antibody test to confirm that you have the antibodies, and then you can make a decision about whether you need to get the vaccine or not.
Okay, we got a call right here. You on with Dr. MJ Collier. Good morning.
Yeah, I'd like to know what are they going to do for the truckers that's out there when it comes to that vaccine? They said first responders as doctors, nurses, et cetera, but even including this vaccine, everything gets moving by a truck. But if we get sick, everything shuts down. So what could we do as for part of that vaccine?
Well, I think that the truckers are going to be considered essential, and they'll be next in line. It's just a slight pecking order there, but it will be available for the truckers because nothing moves in the United States or the world without the truckers. The entire transportation system is based on moving containers, trains, planes, automobiles, ships, everything uses containers. The truckers will be getting those vaccines, I'm sure. So it will be available. They will be considered essential, and everybody will be. So, a 3-month waiting period and you basically having a vaccine in a year is unheard of. So we're getting there. It's just a process.
There it is, Dr. Collier. Let everybody go and give us your disclaimer.
Okay, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley or the Rickey Smiley Morning Show or its radio affiliates. You can reach me on all social media at ASK Dr. MJ. And shout out to the First Lady. Today is her birthday. We want to say thank you, Dolores, for all
Happy birthday!